later. So I just wanted to welcome everyone. My name's Carol Shade. I'm co-chair for this clinical informatics group within the Washington HIMSS chapter. And today we're actually picking this up. Yeah, here's a little bit about our board. So Kelly Nettle, she'll actually be our moderator for today's session. She's the chair for our clinical informatics committee. And then I introduce myself, Carol. I work at Seattle Children's, and Kelly's with the UW Harborview. I guess it's an organization or a hospital group. And then Jen Garcia is our program chair, and Christina is our secretary. And I think the last one, Erica, can't see with my screen. Erica is our program members chair. So it takes all of us to keep this little thing going. So we really appreciate the participation. I think we're up close to 40 participants. So this is great. Thank you. So today's session, we're actually picking up last September. I don't know how many people participated, but last September, we had a really positive feedback on a session that we held that was actually in person. We're in kind of a different world right now with everything with COVID and doing all of the virtual meetings with Zoom or WebEx or Teams. But we had a really good session where we had a panel discussion. It was about bridging to informatics, and we had speakers of CNIO and some about digital telehealth, and it was really, we got positive feedback. And so what we decided to do is set up a session that were a 3-part series, and this is the first part of the 3 series. And so the rest of the board members will be introducing the panelists that we have for today, but I think we have a really great resources here to share some about their programs today. So I need to move my chat box here. Hold on one sec. Yeah, move that. So yeah, our session, our next sessions, I just want to make mention to those. So there's one in October, which is our part 2, and that one's really looking at a lot of different roles and varieties within informatics. Those of us that are already working in that understand that there's a lot of different roles. Pharmacy informatics, trainers, you could be a big data person who looks more at reports and analyzing the data. You could be part of a health tech startup. And so we'll look at a lot of the various roles that you can, that kind of all fit under healthcare informatics or clinical informatics. And that's our part 2 on October 22nd. So you can find that information on our site to sign up. And then our part 3 is in November 19th, and that's looking a little bit more about some of the different certifications that you can take for that, either through ANCC for nursing informatics or through the CP-HIMSS, which is Certified Professional Health and Information Management Systems, as well as CAHA IMS certification. So just a great way to kind of expand your career as well as going back to school. There's different certifications and some about resources that we can get from those. So again, this is the 3-part series. This is the first part. Welcome everyone. And with that, I will turn it over to introduce our awesome panelists for today's session.
Hi, I'm Kelly Nettle. I'm the HIMSS Washington Informatics Committee Chair and the Washington HIMSS Treasurer, and will be your moderator for tonight's panel discussion. This is our first virtual event, like Carol said, and we're very excited to bring this to everyone, being in such a strange season that most of us probably never thought we'd ever see before. But we're excited to bring this 3-part series, and so that we can all understand how it is to get into clinical informatics professions. You know, what are those first steps? What are those different programs? What are the opportunities that are out there? So we want to welcome our speakers tonight and thank them very much for being willing to share about your programs. Many of us have already been through some of those programs, and I know that I have some really great fond memories of going into my program and being able to get to the other side and graduate in 2013. We realize there are many programs available out there. However, we just wanted to give you a taste of what some of those clinical informatics programs are. So we found 4 great speakers to participate with us tonight. So I'm going to have our committee board officers go ahead and start introducing our wonderful speakers.
I'll go ahead and start. As Carol introduced me, I'm Jen Garcia, and I serve as program chair for our Washington HIMSS Clinical Informatics Committee. Thank you all for attending tonight. We're really excited to have all of you here. Please join me in welcoming one of our first guest panel speakers. I have the honor of introducing Dr. Andrea Hartzler. So she is an associate professor in the Department of Biomedical Informatics here at the University of Washington. Andrea is also co-director of the Clinical Informatics and Patient-Centered Technologies Program, or CIPCT, an applied master's program that is jointly offered by the School of Nursing and School of Medicine here at the University of Washington. In addition to teaching and leading patient-centered initiatives at University of Washington Medicine, Dr. Hartzler leads a research program on the human-centered design of collaborative health technologies. She has also served on multiple national committees for the Office of the National Coordinator for Health Information Technology, as well as AMIA, American Medical Informatics Association, and many others. So thank you for joining us this evening, Dr. Andrea Hartzler. I'm going to continue by passing the baton over to my colleague, Christina Dela Cruz.
Hi, everyone. This is Christina Dela Cruz. I serve as the secretary for the Washington chapter HIMSS for the Clinical Informatics Committee. First, I want to apologize. My video has not been working. I think I may have uploaded way too many backgrounds from our past meetings, so I'll be working on that. So I will be introducing Dr. Scott Nelson. Dr. Scott Nelson is a pharmacist and assistant professor in the Department of Biomedical Informatics at Vanderbilt University Medical Center. Dr. Nelson received his PharmD and MS in medical informatics at the University of Utah, as well as a 2-year fellowship in medical informatics with the Department of Veterans Affairs. He has been at Vanderbilt University Medical Center for a little over 5 years, where he's the program director of the MS in Applied Clinical Informatics program and a clinical director in health IT. His practice and research interests are in medication safety informatics with a focus on medication reconciliation, e-prescribing, clinical decision support, and medication alerting. So thank you, Scott, for being here. And if we can all welcome Dr. Scott Nelson.
Thank you very much.
Thank you, Christina. I'd like to introduce to you Eric Stewart from Bellevue College. Eric is a certified project manager with over 20 years of experience managing projects in information technology, healthcare, aerospace manufacturing, human resources, and legal support services. He is currently the program chair for the Healthcare Informatics program at Bellevue College and is an instructor for the Project Management Certificate program at UW Continuum College, and instructed and designed the first change management course for the UW certificate program. He has also taught project management and Lean Six Sigma course for Providence Health and Services and GE Healthcare, and contributed to the curriculum for PM Skills for Life, a course for non-PMs sponsored by PMIEF, Project Management Institute Education Foundation, and is also teaching PM certificate courses at the Everett Community College, Corporate, and Continuing Education Department. He has a passion for teaching and has experience in adult learning in academic, corporate, and nonprofit learning environments. Welcome, Eric. We're glad to have you.
Thank you for having me.
All right, hi everybody. As Carol introduced me earlier, my name is Erica Jalseth. I am the membership chair for the Clinical Informatics Committee, as well as the scholarship chair for HIMSS Washington. So I'm really excited and honored to introduce Dr. Oz Kanak. He comes from the University of Colorado School of Nursing, where he's an associate professor. Currently, he's teaching courses on foundations of health informatics, system development and lifecycle, and clinical support systems. His research interests include organizational and social consequences of health information technologies. And he's currently interested in collaborative clinical decision support, systems that account for clinical information, as well as daily living routines in the context of patients for individualized care. We're so very glad to have him join us this evening, and let's jump into the discussion with the panelists, and I'll hand it back to Kelly.
Thank you.
Thank
So,
you.
so about 5:20 to 6:15, we're going to have our panel discussion. And about 6:15, I'm going to have Christina do some Q&A from the chat, and we'll throw those questions out to the panel. So at 6:30, when our presentation ends, I'm going to have Jen and Erica give away some prizes. We've got some fun prizes to give away to 3 people. And then what we're going to do is from 6:30 to 7, if everybody wants to stay and chat, you're welcome. We'll stay online till 7 o'clock. So question 1, and I thought that we could just go, we'll start with you, Andrea, and just kind of go down the list. Healthcare informatics is a field that is exploding and creating enormous employment opportunities. According to the Bureau of Labor Statistics, it's projected that jobs in healthcare will grow by 19% between 2014 and 2024, resulting in approximately 2.3 million new jobs. Many of these jobs are going to be in clinical informatics. This is very exciting to all of us who are participating, and it's ideal and new for seasoned healthcare professionals and new healthcare professionals looking to advance their careers, or even IT workers interested in transitioning to the healthcare industry. So for your programs, can each of you, starting with Andrea, provide us with a 3-minute commercial on the benefits of your program? And so what I'm going to do is get your slide.
Great, thank you. So I guess I'll jump in while you're getting the slides up. Thanks for that introduction, and it's really thanks so much for the invitation to come tonight. This is my first Washington HIMSS meeting, and it's really a pleasure to come in and speak with you. I'm the co-director of what's, as Jen described, the CIP-CT program, or the Clinical Informatics and Patient-Centered Technologies program. And I've somehow lost my screen here. Give me 1 second. Did my slides come up?
Can you see your slides? Can everybody see?
No.
Not yet.
Not yet. Okay.
No. Okay, but I found my Zoom screen, so I'll be able to see that. So I think they're coming up now. There they are. Great. Thank you, Kelly. So I'm the co-director along with Dr. Donna Berry, and David Campbell is our staff advisor. Can you go to the next slide, please? Thank you. So our program, CIP-CT, is it's an applied master's program. It was established in 2005. So we've been around actually about 15 years now. I've been the co-director for the past 3 years, and I have loved it. It's just been wonderful working with students like Jen and others here tonight. It's a joint program between the School of Nursing and the School of Medicine at the University of Washington. I'm from the School of Medicine, and my co-director, Dr. Donna Berry, is from the School of Nursing. So it's a really nice, unique joint program. We're accredited through the Northwest Commission on Colleges and University. We're a HIMSS approved educational partner, which means we can offer all of our students things like complimentary memberships to HIMSS, which is a really cool benefit, and that's been fun. We also provide the didactic component to 2 accredited fellowships, one at the University of Washington and one at Madigan Army Medical Center. So we get to have fellows. We also attract a lot of physicians, a lot of nurses, and other increasingly diverse healthcare professionals in our program. Next slide, please. Oh, you already did. Thank you. Okay, so our focus really is on providing graduate level training to health professionals to help them to understand, implement, manage, and evaluate the use of informatics applications for patient care. So we're an applied program. So we have other research-based programs at the University of Washington that I'm a part of. CIPCT is really meant to focus on clinical informatics training in an applied focus to be able to use these technologies in practice. And so we really emphasize clinical informatics leadership in our program. So many of our graduates end up going on to C-suite, so CNIOs, that should say CMIO, but we do have a lot of wonderful nurses as well as physicians. We have folks that go on to clinical analyst positions, as well as things like solution director, clinical strategist, and informatics specialized nurses and physicians. We also are starting to attract optometrists and people with all kinds of diverse healthcare backgrounds, which is really exciting to begin to see. Next slide, please. And I'll go quickly through these last couple. Just in terms of our program format, our curriculum, we can get students through full-time in as little as 15 months, but most of our students continue to work full-time. And so it takes about 2 years to get through our curriculum. Our curriculum is aligned with the AMIA core competencies. We have 11 courses, core courses, and a scholarly project that's applied in nature. And those are a really nice way for students to be able to pick up a project that they create themselves and really be able to explore that in depth. Our program is online, and so we do, we're already prepared when COVID came to transition online, so it hasn't impacted us too much. And our students really do a lot of things like discussion boards and group projects to be able to get to know one another. So the online is really a benefit for people that are working, but we also find ways to encourage people to really connect. We also have one in-person meeting, our annual meeting every year to kick off the academic year. Next slide, please. I'm sorry, I feel like I've gone over my 3 minutes. I can come back to this later, but our applications are due in May each year. And I think I'm happy to send out these slides and you can explore some of that information through the links. So thanks.
Thank you, Andrea.
Mm-hmm.
And so, Dr. Scott Nelson?
So thank you, Andrea. That's a very similar to the program we have here. So you gave a great introduction also. So I would say for our program here at Vanderbilt, the Masters of Science in Applied Clinical Informatics is similar in that it's very focused on the applied nature of how can we use informatics principles for improving healthcare. It's a 36 credit hour curriculum over 21 months. So it's just under 2 years to finish it. It's really course heavy for the first year and then followed by a second year devoted to practicum experience and a mentored capstone project. We also follow the AMIA core competencies for education. And the MSACI program will also satisfy the educational requirements for physicians that are seeking subspecialty certification in clinical informatics. We have some informatics fellows in our program too. And I would say something that really sets our program apart at Vanderbilt is that we also provide an online education environment similar to at University of Washington. But what sets us apart is that we draw our instructors from the largest department of biomedical informatics in the nation. And it provides a very diverse group of faculty with lots of different projects that are in the very applied or translational science kind of area. We also have a lot of faculty that are into PHWAS and genetics and artificial intelligence. And so it really provides our students with a great opportunity to find a mentor in a field that they are really interested in pursuing, and getting a great diversity of networking and working with other people with lots of different backgrounds. Our goal is really for our graduates to assume leadership roles in the application and innovation of clinical informatics nationally, wherever they may be. A lot of our graduates move on to leadership roles in informatics, such as CMIOs and application development directors. We have a diversity of students from all kind of walks of life in backgrounds. We have some that are very technical, that have been doing computer science and development for a long time and are learning more about the healthcare field. We also, the majority of our students are actually physicians that are getting into the informatics field. So it's a good blend where we can learn from each other's experiences and work together.
Thank you very much.
Thank you.
It's so exciting to hear about these programs. Eric.
Hi there. I'm from Bellevue College. Ooh, my screen just flipped. Oh, okay. So HCI, Healthcare Informatics, is part of the Health Sciences Education and Wellness Institute. We have two different offerings. We have a Bachelor of Applied Science, and we also have a Bachelor Certificate. And so these two, between these two offerings, this was a program that was created in 2013, and we're continuously bringing new skills, upgrading so that we have relevant work experience, user experience, project management, agile methods. Our program is 100% asynchronous. So again, the COVID didn't affect us at all. This really works well with working adults so that they can take courses, they can watch lectures, they can do discussion boards offline. We've got two big sections of our program. One is about data systems that primarily focus on the EHR, but also include integration with ancillary and business systems. And then the other part is data analytics that focus on data standards, metadata management, analytics, and visualization. And then we have some supporting classes that are in the Bachelor of Applied Science, and then are kind of an a la carte for the certificate program. And those like governance, patient quality, teaching and training in healthcare, statistics, usability, and change management and leadership. We've really tried to put a lot of the essential skills that are included into informatics, including problem solving, critical thinking, design thinking, systems thinking, emotional intelligence, communication, interpersonal skills in virtual workplace. Our target for our bachelor's is these are students that are seeking a four-year degree or seeking a bachelor's after an associate. These are ones that are entering the workforce that are looking for technical STEM related fields. So we're looking for really that entry-level informaticists to give them the skills and experience they need to be able to go out and find a job in this field. We want to be able to give them the healthcare related concepts, and we also want to give them experience. Part of our program includes an experiential learning with either in a capstone or a field study at the end. We also have the certificate, which is professionals that already have a bachelor's degree that are already in the field that are seeking to move over into informatics. And so where they've already had their previous bachelor's, it's streamlined so that they can finish in about a year. They can do this off hours on their own time. And so the goal is to really get people ramped up so that they can enter the field and really focus on supporting healthcare informatics. So our bridge is really between those healthcare professionals and technology, and also including the patient community. So looking at things like supporting the EHR, making sure that training is supported within the clinics and hospitals, and also be able to support any sort of community type of programs through informatics. So our target is really specialized for the group that's just entering the informatics field.
Thank you very much. This is wonderful. Mustafa.
May I have my slides? I can start without slides. That's fine, actually.
It looks like Kelly's working on pulling them up, so.
Right.
And you're on mute, Kelly, if you're talking.
I will get them up.
Thank you.
Thank you very much for the opportunity to talk about our informatics program at University of Colorado College of Nursing. So we have an MS program since on health informatics since 1997, and we also have 2 certificate programs. And most of our students, big majority of our students are actually nurses. We mostly teach students with nursing career and nursing background. But the certificate program is open to any profession. So our informatics education has 2 foundations. So it seems like the one common foundation is the American Medical Informatics, the competencies and the foundational domains defined by EMEA. But we also use a lot American Nurses Association Nursing Informatics Scope and Standards of Practice. These are 2 our foundations. So so our program is completely online, and actually students, most of the students, they come to campus for only a graduation ceremony. And our program is tailored to prepare students to plan, select, design, and implement emerging technologies that advance consumer engagement, support clinical decisions making, promote safety, and drive quality care. And we are a member of HIMSS Academic Organizational Affiliate Program, and we are also part of WICHE Western Regional Graduate Program. So this program allows a bunch of Western state students to study in our program for institution. And our students and the faculty, they are actually heavily engaged with a bunch of HIMSS activities as well. So these are on the screen, you see some of the, like a list of our courses that we offer. The one in red, these are core informatics courses, and the one in the green, these are like the elective informatics courses. And the blue courses, these are the core nursing courses for master students. And the next slide. And just like mentioned before, our graduates also go to various careers and at different levels, some of them more entry level, some of them more C-level careers. And this is just a small list that we also have a lot of students working in the diverse healthcare settings, such as big hospitals, small clinics, state public health departments, consulting companies, healthcare, software industry. And that's all. Thank you.
So Kelly, are you on mute again?
Can you hear me now?
Yes.
Okay. I think I'd find it hard to choose a program with all the wonderful opportunities that there are. Everything being online makes it even more challenging. So question 2, and I'm going to throw this out to whoever wants to answer this. Why do you think informatics is an important field to pursue, and how does it impact or make a difference in the healthcare world?
I can start. We see that the informatics tools and approaches become more central in care delivery, and the information about patients and knowledge about the medicine, nursing, and pharmacy domains have been increasing day by day. And the informatics is key for all stakeholders to access and use this information and knowledge. However, the many promises of informatics have not been realized yet. For example, when we look at the places where informatics interventions are more mature, such as like hospital settings, we know that decision support systems are underutilized, or the artificial intelligence-based approaches still not well integrated. So there is still a lot to do. And given some settings like nursing homes and the emergency medical services, the utilization of informatics is very limited. So basically, there's a lot to do for informaticians.
Guess I'll jump in because I thought this was a really great question, and I think Mustafa, you raise a lot of really good points about the opportunities. I think it's always an exciting time to be in health informatics, but right now is really exciting. I think in addition to some of the points that Mustafa raised, we're seeing increasing healthcare costs. We're seeing an aging population who's living longer with chronic conditions. Like Mustafa mentioned, that science is producing new insights faster and faster. What else? I took down some notes. We're seeing a shift in our workforce, right? So a lot of people are not wanting to go into primary care because the demands are so high. So at the same time, concurrently, we've just seen an acceleration in technology and what informatics can do, and what some of the newer technologies and artificial intelligence and all of these exciting advancements can do. So there's this real opportunity, I think, to leverage that and to be able to not just advance things for the tech savvy, but also to be able to capture folks that are getting left behind. Look at the digital divide, some of what COVID's really surfaced about who we're not capturing. So who are these underserved groups, and how might we use technology to better meet their needs? And then with all that data that we're capturing, there's a huge opportunity to learn and do big data science, learning health systems, if people have been working in that area or heard that term. So really being able to learn from the data in electronic health records and make care more personalized and more local. So I got super excited about this question because I think there's just so many opportunities that are just blossoming, especially with COVID. I'm going to stop now.
Thank you. This is great.
One of the things that I found that informatics adds is that it becomes the conduit between technology and healthcare. One of the folks on our advisory committee says, I speak nurse and I speak tech. And so a lot of my background in installing EHRs had to be, I had to understand the workflows of how healthcare work. What are the important parts of that nurses and doctors need from technology, and then being able to translate that to the technology side to be able to bring out the best of what they have, and to add in that usability element to be able to do a lot of empathy, emotional thinking, being able to understand what are the needs for healthcare, and be able to translate that into technical solutions that really work. That conduit in the middle really is where informatic lands. And so the opportunities there are just growing, and it's really an expanding field. It's one of these things that's becoming more entrepreneurial, that's actually really entrepreneurial rather than a set, you need these skills. People in this field really need to think outside the box because of the way informatics is expanding to healthcare professionals, to IT, and even patients themselves.
Yeah, and I would totally echo everything that's been said here, and just how pervasive informatics and technology are in all of healthcare and everything that we do. It's an exciting opportunity to be able to help enable and empower our clinicians and our patients to provide optimal care. One of the things that I really like the most about informatics is the opportunity to help tailor and personalize healthcare to an individual patient, but at the same time be able to scale that up to populations. And so it's a great opportunity to really make a difference in healthcare in the population and for individuals that we're able to touch. So it's a great opportunity. Hot job market too, like was said earlier.
Yeah, being a clinical informaticist for several years now, I kind of think of myself as the bridge. You know, I think tech, and I also am a nurse. So it is very important, just what everybody has said, to be able to bridge that gap for those who went into nursing or went into healthcare, not realizing that technology would play such an important part of our daily life. That wasn't something they thought of when they went into nursing years ago or into those healthcare roles, but now that is an everyday part of life. They have to learn it or actually leave their profession. So having these programs, having people out there understanding that bridge, understanding that gap is so important. So next question, when people think of informatics, they assume every individual in the field must be techie. Explain to us in your own words what you think informatics is and how experienced or inexperienced in tech do students need to be. For example, do you need coding, database, or programming skills before entering into this profession?
I'll take a shot at this one first, I guess. So one of the things about informatics is it's not very well understood by a lot of people. And I mean, I found that one of the quickest ways to kill a conversation is to tell someone I work in informatics, and they're like, I have no idea what that is. And when I was in pharmacy school, they're like, oh, you should do an informatics course and learn about motherboards and databases and hard drives. And I'm like, no, that doesn't interest me at all. But then when I found out what informatics really is, like I got so excited about it. And it's like a huge passion of mine. How I would define informatics is really the study of information, and that information and how it's shared between a person to a computer to computer, a computer to person, or even between two people. And so it doesn't have to necessarily have technology. Most of the time it does. And as far as being techie, it really depends on what facet of informatics you're interested in. It's an incredibly diverse field. If you wanted to go into something in like machine learning and data science, then being able to code would be super helpful. But there's lots of other places where you don't need any programming experience. I would say to students that ask me this question that it is not necessary to know how to code, but it is really helpful to be comfortable with technology or to be familiar with some of the concepts of programming, like if-then statements and Boolean logic is so super helpful. But the chance that you'll sit down and write a JavaScript or Python is very, very low. At least at Vanderbilt, we have developers that's what they do and they're super good at it. And we can kind of act as a bridge between the clinical expertise and the technical expertise to come up with those solutions.
I'm going to echo what.
Go ahead, please.
Okay, I got to echo what Scott said in that you don't really need to know coding, but it helps if you do know coding and you go out there and get Python. It will help you in a part of it, but you really don't need to know the coding and the details that happen in the machine. It's really being able to interpret how the system is put together. What are the systems that link together? How do these systems link, and how to be able to explain the technology on the side to healthcare professionals in their language, in their frame of reference, to be able to make it simple enough to be able to explain, this is what the computer does, this is how it works, this is the opportunities, and then to be able to listen and say, listen in their healthcare language and understand their processes and their healthcare needs, to be able to go to the developers who are the ones that are coding, the ones that are developing the systems, the ones that are developing the infrastructure, and say, this is what your customer needs. And to be able to understand what's the foundation for the technology, how do maybe not how to build a relational database, but really to understand what are the limitations of a relational database so that you can speak that language to people who are coding, developing, building screens, building reports on that side, to be able to be that conduit so that you can speak in their frame of references as well. So you don't have to be fluent in coding. You don't have to know how to do surgery. You just have to be able to understand and speak each other's language so that you can be that conduit that translates between healthcare and tech.
That's good.
I think I'll just repeat briefly what Scott, Eric, and even the Kelly mentioned. Like most of the informaticians, they work like a translator between clinicians and the tech people. And now there is also data scientists. So the many informaticians, they also need to be translator between the data scientists and others as well. So some informaticians, some settings, some work settings, actually informaticians do some basic coding as well, but some places they don't. So it is very situational thing whether what informaticians do.
I guess I'll just jump in and echo. I think the points are really, it's exactly what I was thinking as well. In our program, we make a distinction between proficiency in something like SQL, machine learning, natural language processing versus familiarity. And I think for our applied program, we target familiarity so that when our graduates are leaders out in the field, they can, like as Eric was saying, be that conduit, be that communicator, and also make decisions that are informed by knowing what are some of the advantages and disadvantages of, say, AI. And if you turn that on in a health system, what are some of the potential downsides to it? I think there are places for that proficiency side. So if you're going to get a PhD in healthcare data analytics and you want to develop the next algorithm, for decision support in some area, that might require some technical skill and coding. So I think that gets back to kind of full circle to where Scott started with, kind of it depends, but there's a whole heck of a lot of opportunity without having to have deep technical skills. There's really a need for everybody, and people skills as well, and communication skills.
Thank you. Okay. Next question. What are the kinds of jobs or roles or opportunities would your graduates apply for after completing your program? And I know already you've talked about what those roles have been. Maybe we should change up the question as, what's the most types of jobs and roles do your graduates go into after your program? Are there any trends or any patterns from your programs?
I would say majority of our students, if they are like the beginner level informatician, so that's, I don't know the other programs, but our programs, students come with very, very diverse backgrounds. And as the result, they leave the program sometimes with different qualifications. And at the beginner level roles, I would say mostly clinical analyst. And we have some graduates actually started as a chief nursing informatics officer. So and everything in between.
Exciting.
I think I covered this a little. I gave some examples in my slides.
Mm-hmm.
I think the trend that we're seeing is diversity. We're seeing a lot of people go into the leadership roles, the CNIO, CMIO, because there's a real need for that. But there's also, in multiple departments, it's not just the head CMIO or CNIO, but every department is beginning to have a need for leadership in informatics. So there's a real diversity at the leadership level. We also see a lot of people going into clinical informatics, clinical analyst roles as well. We have a large adoption now, a wide adoption of EHRs, and so now there's a need to customize those EHRs, maintain them, keep them scaled, and that creates a lot of opportunities. So I think kind of like Mustafa, we're seeing people go out at multiple levels, but most of our students in our CIP-CT program are healthcare professionals, so they're going back into the healthcare system and picking up those kind of patient care facing and direct clinical roles.
We've had a couple of our graduates work for Amazon, go to work for Amazon, and so they're becoming an informatics presence as well. They're breaking into that market, and so two of our graduates actually were picked up by there, and actually it's been three now. Three of our graduates that were in field studies went out to find a opportunity and actually made themselves a job. Where they were being a field study student, that small business hired them on to manage the electronic record in their space. So they've actually been able to make their own jobs. So we're looking for that. How do we, not necessarily the leadership level, but we're looking at how do we supply that informatics support in there.
Thinking outside the box.
Yes.
As far as graduates, our system is very similar to what Andrea was describing. We have a lot of healthcare professionals, and so a lot of times they'll go back into their roles and also have a leadership role in informatics, maybe for their department or their division, to help champion changes or build in the system. And then we've also had quite a few go on to be CMIOs at like smaller health systems to lead the informatics initiatives there.
That's exciting. So what I want to do is turn over the questions to the group from the chat. So Christina, I'm going to hand the baton to you.
There we go. Just had to unmute. Okay, so it looked like we had a lot of really good questions. So for the panelists, questions we got. The first one, how do some of your programs measure the success of your programs with regard to keeping up with healthcare priorities and trending technology?
So it's hard to say whether it's really measuring or not, but we make sure the readings, etc., the content is from last 5 years. So that's kind of one, and we update content almost every year, and we update the curriculum every 5 years. And when we update the content every year, we make sure all the readings, etc., they are from last 5 years. That's kind of how we make sure we stay up to date. And also our faculty attends at least a few conferences per year, and we encourage them to bring material from these conferences. It's not really measuring, but these are some methods we use to stay up to date.
One of the things that our program is doing is it's developing a scorecard, where since now they've got a data geek for the program chair, I've been in there producing a assessment where we're trying to match up the skills that healthcare informatics directors and VPs. I polled about 25 different informatics professionals, leaders in the field. We've got a scorecard of skills, of hireable skills that we're looking to make sure that are embedded in our programs, and then grading each class in our program to make sure that it meets at least one. And when we're done with this scorecard, it's still something in work, but when we're done with the scorecard, we're going to have how the skill matches up with the class, an assessment tool that will identify the critical assignment that meets that, so we can track that using metrics and make sure that we're meeting the goals and producing hireable skills.
Okay. Anyone else from the panelists want to answer this question, or you want to move on?
Yeah, I'll just add, so I think our program is more similar to Mustafa's in that our faculty are, researchers and leaders in the field. So we attend national conferences and have research programs that really have keep a good breadth of the advances and bring that back to the classrooms. But we also map our curriculum to core competencies. And I think Scott mentioned this too about the Vanderbilt program. So AMIA and other organizations have competencies. We follow the American Medical Informatics Association competencies. And so we map our curriculum and our course objectives to those core competencies so that we're making sure that we are prioritizing the concepts and foundations that are prioritized in our field. So that's how we do it. We don't have a scorecard metric, but that's a really interesting idea, Eric, to ensure that those skills are coming through.
Yeah, and we do the mapping to the AMIA core competencies also. And there was just recently released a practice analysis from AMIA on what people out in the field in informatics are actually doing. And so we're making sure that our curriculum aligns well with that so that people are getting jobs after graduation. And a lot of our physicians have gone on to do the AMIA clinical informatics certification as a subspecialty. And in our faculty, we've had a great blessing really with Cindy Gadd is one of our faculty, and she's been leading a lot of the advanced healthcare informatics certification through AMIA, the AHIC certification. And I've also been involved in that, and the practice analysis and making sure that we're keeping up to date and fresh with what the competencies and job market requirements are.
Okay. So just to piggyback off of what you just said, Scott, there was someone in the comments that said that they have a master's degree and an ANCC certification in nursing informatics, but there's still difficulty in finding work. So do any of you have any advice on the job search process, any other maybe certifications to get to maybe help with the job searching?
So that's a great question. And I know a lot of organizations are hiring. Right now, there's kind of a downturn with the whole pandemic. Mm-hmm. But what I've found or had experience with is when they're posting jobs, they tend to not put something that says informatics in it, because then anybody that knows how to use a computer mouse applies for it. And so a lot of finding a job is really networking and being able to meet people in meetings such as this, networking within the HIMSS organization or AMIA or other places. For example, the job position that I assumed when I came over to Vanderbilt was targeted really for a nurse. And it was listed as domain specialist, which I have no idea how I would ever possibly find that. But it was found by going to meetings and talking with people, and found out that they had a position open. I convinced them that a pharmacist would be a really good fit for that position since it was related to medication reconciliation. And that's how it all started. And really the informatics field is so incredibly diverse. Mm-hmm. There's so many different things that you could do. So networking is a huge one. Flexibility with job locations too, being willing to move if needed, but there is a high demand and a lot of opportunity. It's just knowing who to talk to and where to find it.
One of the approaches that we take when we're talking to our students that are about to graduate is that during the capstone prep, it's really about marketing yourself. marketing yourself and marketing your skills, being very clear about what are your strengths, what are the skills that you have that you can offer a potential employer, and then being able to look for what you want to do, figure out what you want to do in the market. We really do a lot of education on the difference between hospital environment, clinical environment, skilled nursing facility, home health, so that students really have an understanding about what are the options that are available for them. When they have those options out there, they can make more informed choices about what are the directions you want to go. When you figure out your direction, be able to document your skills, what kind of experience, even if it's in school, to be able to document that and apply that and say, this is the type of thing that I've done already. But the key thing is to be able to market yourself in this job market now.
Okay, any other comments from anyone else?
All well said.
Okay, perfect. Okay, so we have another question regarding more with the courses. Someone asked, how many courses do graduates take in database management and related areas?
So we have one course exactly entitled Database Management System, and it's very technical course, but it is, although it's elective, I would say 80% of the students take it, and we offered once a year. So that's, we have one course dedicated to database management systems and doing some queries, etc.
We, in our program, SIPCT at the University of Washington, we have 11 courses in our curriculum, and 2 of those are kind of database related, one in computing fundamentals and one more on database to, you know, getting into SQL queries and that kind of thing. And again, it's teaching to that familiarity as opposed to proficiency. So it's making sure you understand the concepts, maybe be able to construct and know what Boolean logic is. Like I think Scott had mentioned that, be able to construct a few queries, but not necessarily have to be proficient and be able to, you know, develop a database after that. So 2 courses, short answer.
2 courses.
At the Vanderbilt MSACI program, we don't have a course specific to database management. We do have a foundations in healthcare course where there are a couple modules that talk about database structures and SQL queries. But again, it's very much on the familiarity with the subjects instead of the proficiency. There's another course on clinical information systems that kind of talks about this at a high level too. And it's just really something that's kind of peppered throughout the program.
We have a systems operation course that talks about the role of databases, and then any of the students that are in the Bachelor of Applied Science, they take SQL fundamentals over in the tech, in the business, in the IBIT, that's our computing department.
Awesome. Thank you, panelists. We have about 3 more questions. Are you guys still okay? Doing okay? Awesome. Okay, so another question I've gotten from the chat is, where do you see the future going with informatics careers? Automation is one area that I can imagine growing. An example is radiology images being read by machines with higher accuracy. So could share your thoughts on that.
So yes, that's happening. That's actually one of the radiology is one of the first areas for telemedicine to develop. So actually there has been growing automation for decades. But I think what's really important and to know and like look at libraries and things like that, where there's become more information systems, maybe not necessarily automation, there's still a role for people, you know. Even with virtual scribes, there's need for someone to review that natural language processing and machine learning to make sure that it's accurate and train that machine. So I think there's more opportunities to leverage the technology, but I think that we still need people. We still need those communicators to be able to describe something beyond a black box of what artificial intelligence is to folks that don't have a technical background. So I think I'm reading into your question, Jason, a little bit. Does it mean that people are going away and getting replaced by robots? I don't think so. I think there's more opportunities potentially.
Yeah, I'll just go ahead and speak briefly if it's okay outside of the framework here is I work on the breast imaging module at UW Med, and I was searching through the health sciences library for some articles and found a number of articles about reading mammograms and other radiology studies where the machine learning was producing excellent results. So I was just wondering how far we think some of this might go. I understand that we're always going to need people because machines and just pure logic and reasoning has limitations, of course, and we always need people. But it's hard to imagine sometimes just how far in the next decade artificial intelligence and machine learning will go without having enough technical knowledge myself. I mean, I can read things. We can all access the health sciences library, and I completed a master's degree in informatics as well. But a lot of people have a lot of worries that are expressed about automation, like you alluded to. People would be replaced, cold, sterile places with machines and no people or something. But the reality, I would imagine, is much different.
So,
people and machines, but not machines alone.
My primary job in my institution actually is research, although I also teach in the informatics program. So we are currently working on a proposal that focuses on trust, patients and clinicians trust to technology, AI-supported technology. So it's always technical developments go first, and then the social developments come after that. So if you tie it back to the question, I think more and more implementation issues we will see in the future, and that's going to be important. And in terms of the directions, more individualized care and the more empowerment of patients, these are, but how can we implement technologies who is gonna make health more individualized and empower patients more? I think that's the future direction. But I might be biased because that's the research I am doing on.
This is a topic that's really interesting to me too. In the field of pharmacy, automation has been going on like in radiology for decades. And I actually just barely published a paper a couple weeks ago about demystifying artificial intelligence in pharmacy in the AJHP journal, that goes over kind of at a high level, again, that familiarity with machine learning. And I would say that there is a lot of concern that people have about being replaced. My outlook on that is not even close to being replacing people right now. A lot of the AI systems that we have are what's called narrow or weak AI, in that it can do really good about identifying diabetic retinopathy in a picture, but there's so many other eye conditions that it doesn't even identify at all. And so you still need an ophthalmologist to look over the imaging. The AI really helps facilitate the review and help make it faster and easier. An example of this, I would say too, is implementation of CPOE. In the pharmacy world, there was kind of a fear of, oh, once we have CPOE with clinical decision support, there's going to be no need for pharmacists. And I would say, as far as the job effort and things that we do now in pharmacy, it's far less transcription, which is nice, and a lot more moving into other clinical practices and realms, and more patient touch, more patient contact, more rounding with teams. And so it isn't that things are going to go away and be replacing people. People are going to adapt and change into new areas where they can really use those skills that a machine just can't. And I think empathy is a really important part. You cannot have an AI machine hold somebody's hand and tell them that they have cancer or something. So just that personal touch, I think, is still super important. And those people that I guess are so tied to, I transcribe orders and that's all I'm going to do and I'm not going to do anything else, they will be out of a job. We're going to have to adapt and change and elevate our level of healthcare.
One of the big trends that I'm seeing right now, especially with COVID on, is the amount of distance clinical visits where we're going through the telemedicine, the virtual medicine. Last summer when I was working on a project with the VA, that was one of the big areas that's coming up. The VA shifting to Cerner is really about connectivity so that the health of our veterans is connected. They don't have to download the record and take it to another clinic. They're all going to be connected. And so the underlying message there is connectivity. And now we're seeing on top of that, you don't even have to go to the hospital, you just stay home. And we're going to see a real spread of healthcare, and informatics has to be included in that to be able to get into the people's home, to be able to go through their mobile devices, to go through their telephone, monitoring through their computers. This connectivity is really an area that's going to provide a lot of growth in the next few years. We've just started to see that touched in, and then we were kind of forced down that hallway with COVID. All these doctors are seeing that, you know, the only way that they can see patients is through telemedicine. And now we're probably going to see that industry start to explode as far as where jobs are going. So that connectivity and telemedicine are two areas that are going to be ripe for informatics.
Awesome. Thank you, panelists. Okay, so this next question is kind of a two-parter. Has more to do with courses. So the first part of this question, does your program require students have a clinical background, like a nurse, physician, pharmacist, or can they be non-clinical? The second part of this question is it difficult to apply and get into your program, or is there a waiting list? So who'd like to start first?
So we have a MS program and 2 certificate programs. The MS program accepts only nurses, and one of the certificate programs accept only nurses, but the other certificate program is open anyone with a BS degree. But because of the classes, other students, etc., and we probably accept only someone who's related to healthcare, but some of the courses, our courses are taken by business students as well, who wants to get into the healthcare business. So the only one certificate program of ours accepts non-nurses.
I guess I can add, our program is for folks that have at least 1 year of experience in healthcare. It doesn't need to be patient-facing necessarily, but it's that understanding the work context of healthcare that's really important. So that's for the SIP-CT program, or Applied Masters. We also, in our department in Biomedical Informatics and Medical Education, which is the department I'm in as a professor, we have a research-based master's program, we have a PhD program, we have a new undergraduate program. And so those don't require healthcare experience if you go into the research. And those programs attract people with all kinds of backgrounds, from social science to computer science to pre-med to biology, all across the board. So but for SIP-CT, our applied master's program, 1 year of healthcare.
So our program is really designed for students that don't have healthcare experience that are entering the Bachelor's of Applied Science are really there for the associates, the ones that have come out of high school, they're doing their 4-year. It's meant to give them that exposure to healthcare to allow them to enter into the field. So we're also looking at anybody coming in retraining from a different industry, and we've had several people that have worked out in aerospace and were looking for something different, did not have any sort of healthcare experience, and really train them up, not only knowing what informatics, but also being able to understand how insurance works, how hospitals work, the difference between inpatients and outpatients, those things, so that they had some familiarity going in. Our program, the deadline for our program is August 15th, and we're going to try to change it so that have a quarterly deadline instead of a yearly deadline. Our yearly deadline is August 15th, and we're going to try next winter make it so that there are quarter input places so that we can have students come in every quarter. We have them go through as a cohort so that in the fall, there's all the same ones going together, but we're trying to make it so that they can have come in different shifts and then kind of all start on their cohort in the fall. So right now, as it stands, applications close August 15th.
At the MSACI program at Vanderbilt, we don't require healthcare experience. We do have some people that are technical developers and have been doing programming and application development in a healthcare related field. But we've also attracted mainly a lot of physicians in our program too. So our requirement is at least a bachelor's degree. And for those that are wanting to do research, similar to University of Washington, we also have a research, master's, and PhD program.
Awesome. Alrighty, so another question we have from the chat is, how would you say your programs compare to nursing informatics programs? And what would help a nurse decide which direction to go if they were interested in informatics?
So, our program accepts only nurses, but we always call it health informatics because we define nursing informatics as a subspecialty of health informatics, and because to provide broader perspective, we also introduce students the problems physicians face or pharmacists face, and actually we also have students to make assignment with pharmacy students so that there's an interdisciplinary work. So we highlight interdisciplinary work in informatics, so that's, I would say, maybe one difference.
I guess I can add that our program's kind of interesting in that it sits joint between the School of Nursing and the School of Medicine, and so we see that reflected really in our cohorts, where we have a fair number of physicians and a fair number of nurses that come in, and so it's really, I really like, Mustafa, what you mentioned, the interdisciplinary nature of health informatics, because across all these various roles, there's a lot of fundamental issues that are important for everybody to learn and learn to work together with information systems. So I think might be it might not be that unique, because I think, Scott, maybe you guys also have nurses and physicians, but I guess being able to draw on the faculty in our program is a little unique, because we can draw on the School of Medicine faculty and the School of Nursing faculty. So it's kind of a fun aspect, I guess.
At Vanderbilt, we do have a School of Nursing that has a nursing informatics program, which almost seems like we would be competing, but we're actually really good friends and have a lot of their faculty as secondary faculty in our department. And so we'll cross teach things with each other. I'm not a nurse, so I don't know if I could speak necessarily for nurses, but my personal experience has been as a pharmacist to not limit yourself to necessarily your training or background. When I did my fellowship at the VA, it was intended for a physician, and they're like, well, we can't tell you not to do it because you qualify, but we're not quite sure what we're going to do with a pharmacist. And even now, I'm the only pharmacist in my department. So it's good with all the interdisciplinariness of the informatics field to not limit yourself necessarily to a specific discipline. I would say that that's probably a really good home where you feel really comfortable, and there's a lot of advantages to that, and can be a lot more specific and tailored to nursing kind of questions and problems that come up. But I wouldn't limit yourself to that necessarily.
Our program has a bachelor's certificate that is that you have to already have a bachelor's degree. So if you're in the nursing field and you already have healthcare experience, it's meant to be a year of informatics, learning about informatics, so that you can add that certificate on your bachelor's. So that's our kind of our pitch to nurses, is that it's not a master's. It's not going to give you the extra M on your last name, but it's going to give you the necessary skills that you need to be able to navigate through informatics, especially in an interdisciplinary world.
Awesome. Thank you. And we have one last question. So the last question, what types of innovation are being developed in your online programs? So for example, use of Zoom, discussion boards online, and what else is in the works to provide new ways of learning for your students?
Actually, there's one thing I like to say for this question. So the AHRQ has a project called CDS authoring tool, and I highly recommend all educators or decision support course educators to use it. So I pilot studied it last year, and I'll use it this year for students. So students will be develop very realistic decisions support tools using bunch of terminology languages, and it's also supported by NLM. And then actually, I just got money from our library, so I'll develop a comprehensive assignment and make it put in a public domain, so everybody can use it. Every educator can use it for their students. So the CDS authoring tool, I recommend using it for anyone teaching decision support.
And with the other programs too, I know, do you guys use Zoom for online teaching, for e-learning, or discussion boards for like homework assignments for your programs?
We're 100% on Canvas. So we're really, we make it so that the students can come in anytime and go through and make up their, do their work. If they do it at 3 a.m., it's that asynchronous type of learning. Our focus on innovation is really coming up with, is making sure that a lot of the innovative approaches, user experience, usability, agile methods. I was a certified Six Sigma black belt, and I've been exposed to a lot of the agile processes that they're currently using out in clinicals, out at Primera, out at the different facilities, and to be able to bring that in and say, this is the latest process that's going on that's out in the field, so that you have that familiarity and can speak agile language, so you can know about how innovation works and how you can do DMAIC and Six Sigma and project management and those types of things. So where we would be more focused on innovation and concepts, and we're still doing stuff out in Canvas.
We also use Canvas, and we have kind of a mix of asynchronous lectures and discussion boards, and we have web conferences a number of times that and I think get to know these faces. And those are always a lot of fun. But Canvas is really diverse, and they have a lot of functionality. You can have self-guided quizzes, and you can, if you dig in and play with it enough, you can kind of set up interesting, a lot of different learning experiences. There's tons of material online. I'm on the HIMSS list and get all kinds of digital content. And for me, it's a matter of filtering down from the wealth of information out in the world I could share. And I'm looking at Jen, she's laughing. I always give lots of options in my class because there's so much material right now. So I think there's a lot of ways to do innovative things with what's available out in the world. I guess for our program, one of the ways that students, one of the areas where there's innovation is really around our scholarly project piece. So each student carves out their own project. It's a 1/4 project, but the student gets to really pick what they focus on. And there's been a lot of really innovative work. So there's been research grants on chatbots that students have been able to come in and play a role and publish papers on. And so those are really, I think, some of the touch points where the students really get exposure to some of the innovation, because there's a lot of foundational, really important material like the databases and things that that are looking at SQL and may not be out in the most advanced. So kind of balancing the fundamentals with some of the new and neat, fun concepts. We do that through our scholarly projects.
At Vanderbilt, we kind of used a flipped classroom approach. And so we use a system called Brightspace, which is basically the same as Canvas. And we use that for our discussion boards and pre-recorded lectures and videos and quizzes and assignments and stuff like that. But every Thursday night, we all get together for a synchronous call on Zoom. And so it's an opportunity to have the students interact with each other and also with the instructors for that week. And so each class will have an hour-long block of time on Thursday night. So every Thursday night, we're all together on Zoom from 5 to 8 Central Time. And it's just a great opportunity to then ask questions to the faculty and even deliver synchronous content and work on things together. So that's kind of how ours is structured. And then once a semester, we'll get together for a face-to-face meeting at the beginning of the semester. Obviously, right now we can't do that. So we're just doing a Zoom call for what is typically a face-to-face meeting. But we do have the asynchronous components with the weekly synchronous component too.
Awesome. Kelly, are we doing okay on time? I have one more question from someone who just messaged me.
We have just gone over time, but if everybody's willing, our panelists, are you okay? Okay, go for it.
Okay, one last question. So there's someone who wanted to know with the projects that you've mentioned in your programs, is there going to be something similar to like nursing school where there is a clinical site where the students will be placed to do their projects?
We have practicum. So our MS degree requires practicum, which is like they clinically placed somewhere and they do some specific hours that I don't remember right now. But we do require informatics practicum. We say it's just like clinical practicum, but they become part of informatics project in a real, like in a healthcare organization.
We don't have a formal placement, but I would call our approach, we facilitate connections. So we survey all of our informatics faculty about ongoing research projects. They may have an opportunity for one of our master's students to carve out a piece, a project, and work with the team. So we are able to facilitate those connections. We also reach out to our health system at the University of Washington and neighboring health systems and our friends and colleagues to identify opportunities. So we don't necessarily place in a facility and try to encourage to kind of go out and identify something that would be of interest and serve their interest in moving their career forward and help provide opportunities and options for that. So that's always kind of fun to do that matchmaking.
At Vanderbilt, we have the practicum experience that goes throughout the 2 years for, it's like a total of 240 hours. And then in the first year, they'll work on identifying a mentor for their capstone project. And then the second year is devoted to working with that mentor and mentoring committee to finish the capstone project. A lot of those projects have been really come from the student's home institution. So they may have something at the facility where they work at where they want to improve a project there. And so we'll help facilitate that and provide a mentor from our faculty and put together a mentoring group. Other than that, we do have students that will connect with faculty and get on a project with them and do a small piece of it too.
In our Bachelor of Applied Science, we have a experiential option. They can either do a capstone or they do a field study, and we've been having a really great success with the field study. This is where they work in an office in some sort of healthcare facility for 108 hours. And that has been a phenomenal experience, not only for the students, but for the institutions as well. They've been able to see the caliber of our students. This is a spring event. And so this spring, things completely flip-flop, where we would only have like 1 or 2 students that was unable, that they would do the capstone. Everyone shut down. And so there was 3 students that did a virtual, was able to do a virtual field study, and they spent a lot of hours on the phone. We were able to be really flexible and really get them connected well. And we had a marvelous experience coming out of it. It just wasn't what we had predicted. One of our students actually had to move to South Korea really quickly. And so she had a field study all lined up in January. February, she found she had to move, and she converted over to a capstone, which became her experiential type of learning. But on any other year, going out and having that experience out in the field is really kind of one of the things that our students look forward.
Awesome. Thank you, panelists.
Thank you all so very much. It's very exciting to hear about your programs in the season of COVID, our pandemic, how everybody's become flexible. They're thinking out of the box. It's just really been heartening to hear that it's really pro-student. We want you to succeed. We want you to find that position that you like. We want to find your strengths and kind of push you towards that. That's very exciting. So thank you very much for coming and sharing. Right now, we have some prizes we'd like to give away for those who have attended. So I'm going to turn that over to Jen and Erica. And then we'll keep the event open until 7 if people want to chat and talk and ask more questions. Everybody, please feel free to sign off if that is something you want to do or need to do. But thank you so much on behalf of HIMSS Washington chapter. We're really grateful.
Okay, everybody. So I'm going to take this time to announce the winners of our raffle this evening. We chose 3 lucky winners from our registration list. After I announce our winners, I'll reach out to you via email by end of day tomorrow for your mailing address, and your prize should reach you sometime next week via mail. I put my email address in the chat box, so please make sure my email doesn't go to your spam so that I can obtain your mailing address and get your prize to you as soon as possible. So our lucky winners for tonight are number 1, Terrence Rios, number 2, Rachel Bonney, and number 3, Stephanie Alvarado.
Nice.
So Terrence, Rachel, Stephanie, Each of you will be receiving a $25 Starbucks gift card, and congratulations to our 3 lucky winners. You'll be hearing from me by tomorrow.
That is awesome. So I have a question for the panelists. Do you have waiting list to get into your programs? Any that want to answer?
We do not currently know.
Okay.
We don't have either.
No. Okay.
We
don't
do.
either.
We have a cohort that we accept every year, and that's who gets in. One of the things that some of the other programs might have is a graduate non-matriculated option, and so at the University of Washington, one of the things that is really that we encourage some folks to do is to kind of try before you buy. So, if you're not sure what informatics is all about, you can get your feet wet by taking a couple courses as a graduate non-matriculated student.
Okay.
And what that means is that you can apply on a quarterly basis. It doesn't guarantee acceptance to the program, but you can take a few courses, and if you do decide to apply and get in and get accepted, you can transfer up to, I think, 12 credits.
Yeah, we do have the exact same
You have
thing.
that? Yeah. I think a lot of
That's
people
great.
take advantage of it because
Oh, yes.
I actually did that as a graduate student kind of before I jumped in, and I was glad I did it.
I did
but
that too.
Yeah. So that's kind of it's related somewhat to a wait list, but we don't have a formal wait list either.
Now with, we have University of Colorado, we have Vanderbilt that are long distance. Do you require your applicants, your students, to be on site for any part of their,
No.
other than graduation? I think that's what you mentioned, right, Mustafa?
Yeah. So the art students, they're only Zoom, like the
Okay.
requirement. But I mean, some of them, they come to talk to us, etc. But it's not a requirement at all. Everything's on Zoom.
Okay.
So it's a good question if it's a requirement or not. So we have a face-to-face meeting that we do every semester at the start of the semester. Our students are required to come to that. However, there have been exceptions made where we could attend virtually. And especially during the pandemic, we've made exception for that. But we had a student that they were going to their son was going to be born soon. And so we're like, no, just stay there and attend virtually. So we do have exceptions. We have a student in Switzerland, and it's very difficult for him to travel here for one day. So we do make exceptions to it.
We also have an annual in-person, and this year it's not going to be in person because of COVID. It's highly encouraged to come, and I think people have a good time when they come because they can meet one another, meet with faculty. But we do also make exceptions because we have a few international students every year that makes it difficult.
Right.
When we try to Zoom them in, we're learning how to do that better.
It's such a different time where we're doing so much more remote, and you don't have that face-to-face contact where, that cohort of students is going through all of their, the good, the bad, and the ugly through their programs, and they get very, very close. And, it's going to be very interesting to see the papers that come out after the pandemic of schooling and how students are doing, and do they like it better?
One of our sister programs, Healthcare Leadership and Informatics, they have 16 students out of state, and we compare. We kind of go back and forth. We have 3 students that are out of state. We have 2 international students. So we one up each other.
Yeah, that makes up for the. There was somebody who was from Vancouver, BC. I don't know if he is still on. I think one of the participants, but a HIMSS chapter was just created I think it was late last year for the HIMSS Vancouver, BC group. So we now have an international chapter close by. So.
I just want to thank you all by voice. This is Jason. This is my first meeting to attend, and it was great. I really appreciate the panelists and the people who are chairing the meeting. And so have a great evening.
Well, Jason, we're on the same UW team, so maybe one of these days we'll get to meet each other face to face.
Yeah, let's hope this COVID stuff passes sometime in the next year.
Yes, exactly.
Yeah. All right.
So,
Thank you.
Likewise, I would just really like to thank you all for having me. It's been a complete pleasure to meet with you all tonight and spend the evening with you. Thank you very much.
thank you very much.
I also had a lot of fun. Thank you.
Yeah, me too. Thanks. It's been fun.
Good night, everyone.
Thank
Thank
you.
you.